But if you have that muscle imbalance present, your quads are overactive and you're just smashing that joint because it's a pressure problem, your brand new cartilage cells are gonna get smashed. It's just a matter of time before the knee starts to hurt again. This is no BS advice to heal your meniscus and avoid knee surgery. If you've had a meniscus tear, you're probably worried about having a surgery and you wanna heal this thing and get back to doing active things. So I've got a list of 14 pieces of advice or kind of rules that you need to think about following so that you can properly heal this problem and get back to life as normal. Number one is you need to know what's going on in the surgery world as far as meniscus tears. There's a lot of surgery done. One of the most common ones is called a meniscectomy procedure. This is where they take out a chunk of the meniscus, the part that's torn, and they just surgically cut it out. They'll use scopes. So in other words, they just make what's called ports. They make two little holes in your skin to get into the knee joint. And one of them is a camera and the other one has tools in it that they can change. And sometimes it's like a cutting tool, sometimes it's a shaving tool. There's all different kinds of tools. You can look into it if you want. And it's a really low invasive surgery, minimally invasive surgery. That's what they'll tell you. And, they say that it's still surgery. Yes, there's less incisions, so there's less to heal from, but it's still surgery. They're still cutting something out. What they've found in some recent studies from Finland, I think the first one was done in the early 2010s, where they did a placebo surgery on people. This was a randomized controlled trial where they split people with meniscus surgeries and no arthritis. They accounted for that. They split them into two groups. Everybody had a meniscus tear. Everybody went to surgery, but one group actually had the chunk of meniscus cut out, like the normal meniscectomy procedure, and the other group did not. They still went under anesthesia. They still had the ports made, but they didn't cut the meniscus out. And what they found after the surgery is that both groups got better the same amount. This is crazy, right? Because then it raises the question of, well, do I even need to have the surgery? Because if I never have that chunk of meniscus cut out and I can still get better, then why even get the operation to begin with? And what's even crazier though is they followed up with these patients years later, and I think they did a 2-year follow-up and a 5-year follow-up, and what they found is that the people that had the chunk of meniscus cut out, they had the real surgery done, they were more likely to develop osteoarthritis. So what I think about that is, even though you have a torn meniscus, that chunk that's torn is probably still useful for you. And maybe you still need it because it's protective against getting arthritis. Because that's a big concern, is if once you start damaging the cartilage in your knee, because the meniscus is made out of cartilage, then eventually you're gonna end up with osteoarthritis in later years. This is important information to know because I don't know what surgeons are telling their patients. I don't even know if surgeons are aware of this study. And they had to do it in Europe because they have a different kind of healthcare system than we have in the United States. And they probably aren't gonna allow, there's ethical questions in doing a placebo surgery to people because they're injuring them. And so I don't know if they'd allow it here in the United States, but it's important to know. Now, related to that, there's other studies where they're looking at meniscus tears in an MRI, because that's a typical diagnosis you get. So now I'm going on to rule number 2, or advice piece number 2 here, is you get an MRI for your meniscus, and that's how they determine that you have a tear or not very often. And there's such a thing as a false positive MRI, meaning you are showing that you have a meniscus tear, but you actually don't. And they'll figure that out once they go in to repair it and they say, oh, it's not torn. Then it's questionable if it healed or if you never had it to begin with. That occasionally happens. But with MRIs, they're finding that it doesn't always connect to the pain. In other words, you can have a terrible looking MRI and no knee pain. And the opposite's true. You can have a perfectly looking MRI on your meniscus and have a lot of knee pain. So what we're figuring out from the research is that, is the cause of the knee pain actually the torn meniscus, or is there something else at play? It's possible that it could be causing pain, but it's also possible there's other factors. That's what you need to consider in fixing your meniscus problem. That takes me to point number 3 here. The root problem of a meniscus tear is not age, It's not all those activities you did before, those old injuries. I think those things might play a small role, but the main root problem that is in your control, because you can't control the past, you can't control your aging. That's going to happen no matter what. The main problem is the pressures that you're putting through your knee. And I'm not talking about weight. I'm talking about muscle imbalances. Because when you think of the meniscus right here, this bluish thing right here that I'm wiggling, it's between the thigh bone and the shin bone. And it's designed to take pressure, but a certain amount of pressure. And it's of course your body weight, but a little bit beyond that, because if you run or jump, you're going to impact it with some more force, and it should be able to tolerate that. But if you have something called a muscle imbalance, that the classic imbalance when it comes to a meniscus tear, let me explain that to you real quick, is your quad muscles in the front of your thigh are overly strong. They're too dominant. They're being used too frequently, more than they should. They're compensating. And they're usually compensating for weak butt muscles, weak glutes back here, because they're not doing their job. Quads take over. Those quads attach to the kneecap, and then the kneecap attaches to the shin bone down here. And so if they're working too often and too much, they're very strong, then they're going to press the shin bone up into the thigh bone, and right there where the meniscus is inside the knee joints, here's the thigh bone, here's the shin bone, you're going to press it in and smash it. And because there's something called resting tension in muscles, just think of it this way: when you don't work out for a long time, your muscles get flabby, you have a decreased resting tension. But then when you go work out, your muscles firm up. Your muscles have an increased resting tension. So in a muscle that's better worked out, more active, more used, it's going to be constantly pulling just a little bit. So that quad is just constantly pulling a little bit. It's yanking the shin bone up into the thigh bone. This is why people that have a meniscus tear often will say things like, I was just sitting down through a movie and my knee started to hurt. I have to get up and walk around because if not, my knee starts to hurt if I'm sitting too long at the dinner table. That is because of that increased resting tension just smashing your knee joint. It's a pressure problem. It's the same as if I was to take your hand, if you were to put your hand on the table and I was to just apply pressure to it, you could take it for a little while, right? You could take it for a few minutes, but after 15 minutes, an hour, a couple hours, you'd say, gosh, my hand's falling asleep. It's uncomfortable. If days or weeks went by, the tissue would die because you would literally squash the blood out of it. And it wouldn't be oxygenated. It wouldn't be able to get the nutrients that it needs. That's what's happening in your meniscus when you have that increased resting tension because of the muscle imbalance. It's a pressure problem. You need to fix that pressure problem in order to let your meniscus heal. The medical field doesn't know about this stuff at large. Maybe a few people out there talking about it. I feel like I'm the only person out there really talking about this pressure problem at the knee joint for meniscus issues caused by a muscle imbalance. And really the medical community at large is telling people to do the very things that cause this problem. What the medical community is telling people with meniscus problems to do is to get stronger quad muscles. The muscles in the front of their thigh, they're having them work those muscles out. They're doing extension exercises against resistance to get these muscles tired. They're telling people they need bigger quads. They're saying that that's what's going to fix a meniscus problem. And this carries on even beyond a meniscus problem. In later years when people develop arthritis, same thing. They say, oh, you have weak quads. And in somebody who's been in pain for a while, like if it's been months and you've been inactive, not doing your usual activities, then you might present with weaker quads because you've been inactive, you've lost muscle, your knee's been painful, it's been swollen. But what led up to it was overactive quads. And so you gotta quit strengthening your quad muscles. That's the next point here. Don't strengthen your quad muscles. And you might need to go against what a healthcare professional tells you to do. My advice though, before you completely ditch what your healthcare professional is telling you to do, is try it. Try doing their quad exercises. And it should not hurt to rehab this problem. I have people rehabbing this problem all the time. I've helped thousands of people through our knee meniscus recovery program, and they avoid surgery and they never work their quads in the program. I instruct them not to. This stuff works. But very often people in our program are saying things like, yeah, I went to therapy, I went to the trainer, I did what the doctor told me to do, and they had me doing knee extensions, riding a bike, they had me doing exercises that tired out my quads, and then my knee pain got worse. And then sometimes they get told that it has to hurt more before it feels better, which I think is not true. I don't think that's right. It should feel better right away. It's not like that. That's a no pain, no gain mentality, which is appropriate for somebody who's healthy. You know, like if you don't have any pain and you go work out, you're gonna feel tired. You're gonna feel exercise pains, like fatigue is what I'm talking about, not injury. But that goes away. That soreness, that you might develop soreness a day or two later, that goes away, and then you're stronger afterwards. That's when you might need to push through some pain if that's how you perceive pain. But joint pain, because there's no muscles inside the knee joint. Shouldn't hurt. You got a joint. There's meniscus, cartilage, joint fluid, ligaments. That stuff doesn't get sore like muscles do. So it shouldn't hurt to do these exercises. So if you're out there doing quad exercises right now and your knee's hurting you, you shouldn't be pushing through that. That's a clear sign that you're increasing the pressures in your knee joints, feeding into the muscle imbalance problem, and you're just gonna worsen your meniscus over time and walk yourself into knee arthritis eventually. So my fifth point, what should you do instead? You need to go get stronger glutes. The glute muscles, the butt muscles on the backside of the hip can cause the thigh muscles on the front of the thigh to calm down. The better you are at using the glutes, and then the stronger they are, then you put yourself in the right balance where when you go take steps, when you get up and down from chairs, where you do activities that involve your legs, your quads aren't taking over everything because your glutes are showing up when they need to. When you have weak glutes, the quads are quick to compensate. And you need to figure this out for yourself, because right now what I want you to do, just to even just measure, just whatever position you're in, sitting, standing, lying down, tighten your glutes, make your glutes clench. If your glutes cannot tighten up, that means you're severely compensated. In fact, you probably feel your quads or your other thigh muscles on the back of the thigh, the hamstrings also kick in. Think about that. You intended to fire your glutes and your thigh muscles worked instead. That is clearly a compensation. And that's a key way that I figure it out in people. We need to fix that first. Get the glutes to work when you intend to get the glutes to work, and then figure out how to make your glutes work without your thigh muscles taking over or really contracting at all. They should contract minimal to nothing, and it should be purely your glutes working. Once you can do that, then you need to improve the glute strength. You need to do exercises that strengthen the glutes so that when you go do your normal everyday activities, the glutes have enough strength to accomplish it. Because if they don't, they're gonna tire out real fast, and then you're back into compensating. It's gonna put you back in too much pressure for your knee joint. So you gotta figure out your glutes. Number 6 is don't worry about your weight too much. Now, weight can be a factor, but I feel like it's way over talked about. It's emphasized too much. You might be 10, 20, 30 pounds overweight, and you jump on the scale at the doctor's office, and that'll be one of the first things they point out. Hey, you need to lose 30 pounds, sir. Ma'am, it's been a while with this extra weight. You need to lose that weight. That's what's causing your meniscus problem. And that is not the case. It is rarely ever the case. I have had so many people that are 30, 40 pounds overweight fix their meniscus problem. Now, if your weight is a lot, if you're 50 to 100 pounds overweight, then it is a priority for you to lose that weight. Because the reason why the range is because for a smaller person, 50 pounds is a lot of weight for them. But for a taller person, 50 pounds is relatively not as much. Maybe 100 pounds is a lot for them. The point is that if you can get stronger in the right muscles, the glutes, you might be able to put the right balance through your knee joints despite not losing the weight. That shift of balance into the correct balance is more critical for people that aren't as overweight. So don't sweat it too much if you're trying to lose weight because the doctor said so. You're gonna have to, I can't give you a specific number, it's gonna depend on your height. We usually go off of BMI. If you're severely obese, then it's probably a good idea to lose some weight. But if you're at the beginning of obese, just above beyond the normal weight, the pounds and kilos are gonna vary as far as your height. then you could probably work on fixing the muscle imbalance before you work on losing weight. Very often people have trouble losing weight anyway because of the knee pain. So they get caught in this cycle of, well, I tried walking, I tried going to the gym, I tried cycling, but it makes my knee worse, so I stopped. Then I put on even more weight, and it's just a terrible cycle to be in. Just forget losing weight. Just go after fixing the muscle imbalance first, fix your knee, because then you will be able to get back to those activities without knee pain, and the weight will come off a lot easier for you. Number 7 is get on crutches. You need to be offloading your knee. If you have a known meniscus tear, especially if it's active and aggravated right now, every time you go bear weight on it, you need to get on some crutches and reduce the amount of weight that you're putting through your painful knee to where it doesn't hurt. Because the meniscus is a weight-bearing structure. It's designed to take the weight of everything above that. But if it hurts when you put weight through it, then you're overloading it. You're putting more than it can tolerate right now. So just work it to its current tolerance. Toe touch weight bear, or put 25% of your body weight through that leg and put the rest of it through the crutches while you're walking around. This is tough for people because it changes your life, right? When you get out of bed, now you gotta have the crutches nearby, and you gotta crutch your way to the bathroom, and you gotta crutch out in the community. If you go to work or school or wherever you are, people are gonna ask you, oh, what happened? And it's something that you have to just face. But the truth is, if you can get on the crutches for a few weeks, maybe a month at most, you're probably gonna make more progress than if you try to go on without the crutches and drag it out for months or years and then set yourself up to have arthritis anyway. I would rather you just go through a couple of weeks of consistent crutching to get this meniscus healed up to where it can tolerate your full body weight without having to use the crutches, and then we can get on with fixing the muscle imbalance and fixing the right things. Much better plan than say, well, I'm afraid of the social stigma. I'm afraid of people asking me questions, and it's too inconvenient to carry the crutches around. I don't even own crutches. I got to go buy crutches, and maybe that's your hang up. But then months go by, and meanwhile, your knee problem is just getting worse and worse. Go get the crutches. Start offloading right now. Number 8 is you have to think about your feet. You have to figure out your feet. Feet are important for the knee. If you don't have the right support in your arch, especially for the people that have a fallen arch, a flat foot. Most people have what's called a functional flat foot. And what that means is that if they take their weight off the foot, an arch appears. But then as soon as they stand on it, the arch flattens out. When that arch flattens out, it causes your shin bone above your ankle to move inwards a little bit, which then causes the knee joint to move inwards a little bit. And that puts some bad pressures to the knee joint. And the solution to this is usually getting more toe strength, because the toe muscles, the muscles that curl the toes, help to support the arch. And if you have better strength in those muscles, then you increase the resting tension, like I talked about with the quads, but it's a good thing because that resting tension now supports your arch when you're not even trying to. It's just holding you up a little bit better, which aligns everything better up in your knee joint. It's not just about using your arch muscles and your toe flexors when you're standing, but then it needs to translate into walking and everyday movements. But you need to pay some attention to the feet, because very often what I find is people will go strengthen their butt muscles or glutes, and maybe that's like 80% of the problem, and they get tremendously better, 80% better, but they'll still have some issues that might get bigger later on. The knee pain might get worse later on, despite them working on their glutes like they should. It's because they didn't address their feet. So don't forget the feet. Number 9 is to stop walking. This is a big one. A lot of people with meniscus tears get told, I'll start a walking program. Quit running, quit biking, start walking. Quit going to the gym, start walking. Or get off your butt because you've been very inactive and start walking. Walking seems to be treated as a panacea, like a treat all, like walking cures all. Not the case. If you don't have good glute activation, if you don't have good foot muscle activation, you're walking yourself into a worse problem, because now you're just training your quads to take over all the time. You're letting your arch fall down all the time and putting bad pressures through your knee joint. And especially if you haven't been very active, it might feel good at the beginning to walk because you're outside, you're getting some vitamin D, the sun's hitting you, you're getting some movement that you don't usually get, but then you hit a threshold where your knee starts to hurt more usually. And it's because of that muscle imbalance. So I would say stop walking until you figure out how to walk properly using the right muscles. Then walking can be good for you. I'm not saying walking's terrible all the time. I'm just saying people get told at the very beginning of a problem to go start walking when they have things to fix. To me, it's the equivalent of giving a new driver a race car, like a NASCAR or F1 race car that has a lot of firepower. They're not ready for it. They're going to crash at the first turn. You need to first figure out some basics and get some practice. And it seems kind of odd to tell somebody you need to go learn to walk again, because most people are like, I've been walking. I've walked all my life. I've walked since I was 1 or 2 years old. And you want me to fix the way I walk? Yeah, you're not using the right muscles. That's what led to this meniscus problem. Figure out how to walk first, then go walk for exercise. But if you haven't figured out walking, if you're not using your butt muscles, if you did that test where you try to activate your glutes and your thighs kick in, don't walk. You're gonna make it worse. Number 10, the next one is to stop cycling. And it's for the same reason as walking. When you cycle, when you're on a bike, whether it's a stationary bike, an outdoor bike, even a recumbent bike, the ones with the backrest and the pedals are kind of in front of you rather than under you. They usually have like a TV or something if you go to the ones at the gym. These bikes tend to make your quad muscles work. I mean, think about it. When was the last time you were in a bicycle? Especially if you kind of turned up the resistance or kept your intensity kind of high, got your heart rate up. Which muscles burned? Was it your glutes? Probably not. Most of the time it's the thighs. Maybe it was a bit of everything, but which muscles burned most? It was probably your thighs, your quads very often. Most people don't get instructed on what muscles to activate when you're on a bike. And so as a result, they just do what their body gets them to do. And when you push down on the pedal, when you're cycling, when you go to extend your leg, it tends to be very quad driven, and it's not helpful for a meniscus problem. What you need to do is figure out how to straighten out your leg using your glutes. It's possible. Most people can do it. There's a few people that have a lot of trouble doing it. It has to do with the length of their leg and other factors, but if you can make your glutes work harder than your thighs while on a bike, then it would be beneficial for you. But if currently you cannot make your glutes work harder than your thighs, meaning every time you get on the bike, you feel your thighs work the most, stay off the bike. Don't touch the bike. And what's tough is a lot of my own colleagues, physical therapists out there, the first thing they'll tell patients to do is go warm up on the bike. And their quads are nice and active and ready to fire and add compression to their knee joints. And I don't think that they're doing that on purpose. I really don't. I think they're doing the best they can with what they know. The fact is that most physical therapists are helping people after they have surgery. They've had a meniscus surgery or a knee replacement surgery or an ACL reconstruction surgery, and it would be appropriate to get on the bike to warm up at that point. But if you're trying to avoid surgery, if you don't want that meniscus surgery, then let's fix how to use the bike before you start on the bike. Make sure you are figuring out your glutes. Number 11 is resting indefinitely. Sometimes patients will go to the doctor and the doctor won't send them to do exercises or to a physical therapist or anything like that. They'll just tell them, hey, take this pain medication and go home and rest. Sit, lie down, get in the recliner, just rest. And they don't give them any further instruction. And I think the doctor probably assumes that you'll know that eventually you need to get up and move, but they don't say that. I don't know if it's a time constraint, they don't have enough time, or maybe they don't know to tell you that. But I've had patients that have come in after being seen for meniscus tear, and they'll say things like this. They'll say, well, I went and saw the doctor 3 months ago. He told me to rest, so I've just been sitting as much as possible. I've been lying down as much as possible. And now other things are hurting. My back hurts, my hips hurt, I'm achy all over, I develop sciatica. They'll say things get worse because that's what happens. Our bodies are meant to move. We just have to figure out how to move appropriately and reduce the movement to a tolerable amount of movement that you can do, but completely bringing it down to next to nothing is not good for you. So resting is not a good idea indefinitely. You need to eventually get back to moving. If it hurts to put weight on it, then you shouldn't be putting as much weight on it. But that's why I said to use the crutches, because you're still moving. You're just not moving, not putting as much pressure that's causing pain through your knee joint. Number 12 is don't rely on pain medications. This is so tempting for a lot of people because they can be effective. You can go to the store, buy some pain medication, Tylenol, ibuprofen, some are pretty effective, and you take it and it takes the edge off. Maybe even takes the pain away completely for a few hours. You might even get some good sleep. And it's tempting to just say, well, I'll just live on this for a while. And people don't usually consciously tell themselves that. It's more of a subconscious thing. They'll say, they forget about it. They'll take the ibuprofen sometime in the morning. The day goes on, it's a good day. And then it isn't until nighttime that it comes on again. And then they're realizing, oh, let me take one at night too. They just kind of take it as needed, depending on what the bottle says. Of course, people tend to be pretty good about following instructions there. But what you don't want to fall into is a pattern of just taking it and taking it and taking it, because now you're relying on pain medications to get through the day. There are some serious side effects for some of those medications. Some of them will destroy your stomach lining and can even send you to the hospital or cause death. And there's other effects that are on your liver, on your brain, and other organs. There's effects we probably don't even know about. At the heart of this solution, it's not even solving the root problem. Medications don't get your glutes stronger. They don't get your foot muscle stronger. They don't teach you how to walk or use a bike better. They don't teach you how to move. They're just taking the edge off the pain for a short time. So I'm not completely against them. Don't take it as that. You need to strategically use them. Use it to get better sleep, but be fixing the long-term problem, the root muscle imbalance. Use it to help a relationship because maybe you're really grumpy because you're in pain or because you can't do something and you're frustrated, and you need to just be nicer to people you live with or people that you see on a regular basis. So maybe take it for that reason, but don't plan on taking it for weeks on end. Not a good idea. Number 13, don't count on an injection, a pain injection, to fix the problem. So it's medication. They're just injecting it into your knee. And it can typically be a lot more effective than a medication you take by mouth. The doctor might offer you this if you've already tried over-the-counter medications or even prescription strength medications. And sometimes they're very effective, especially for meniscus problem. You might feel like a brand new person after getting an injection, but they'll tell you this is gonna last 3, maybe 4 to 6 months. And then usually the problem comes right back. And in some cases, very often I see patients will tell me, I got the injection, felt good for like a week, and then pain came back worse. In that situation, what do? The injection is not going to fix the problem. It's just pain medication. It's not making the muscle stronger, not teaching you to move better. It's just masking the issue for a short time. You need to have the injection strategically because the pain's that bad, it's gotten to that point, but then go work on the root problem so that you're not letting it get worse and feeling like you need another injection soon. Number 14 is understand regenerative medicine. So kind of related to injections, I'm talking about hyaluronic acid or gel injections, platelet-rich plasma injections, PRP, stem cell injections, prolotherapy. There's other types of injections out there that you can get to regenerate the cartilage or the meniscus inside your knee. And here's the thing is, these are all experimental as far as the medical community sees them. None of these things are like seriously proven to help the problem. And I've seen the results in patients. Some patients say that it had a tremendous improvement. Some say it had no improvement whatsoever. And none of it's usually covered by insurance. So the ones that don't have an improvement are quick to tell me, and it cost me thousands of dollars and I didn't get an improvement. It's up to you to try it out and see if it works for you. Talk to your doctor, of course, to see if it's an option. But still, it doesn't make the glutes stronger. It doesn't make the quads quieter. It doesn't fix the toe flexors down here. It's not doing anything to fix the root problem. It's not teaching you to walk right with your glutes and exercise right with your glutes. It's not fixing that problem. And for that reason, I tell people this all the time. This is a huge piece of advice that I give people. If you're gonna go get stem cells, if you're gonna go get gel injections, fine, go get it. I'm not against it. Go try it out. But understand that if you get stem cells done and you're hoping that you're gonna get new cartilage cells put inside right here in the knee joint, hopefully it works. But if you have that muscle imbalance present, your quads are overactive and you're just smashing that joint because it's a pressure problem, your brand new cartilage cells are gonna get smashed. It's just a matter of time before the knee starts to hurt again. Even if you had a successful stem cell treatment, even if the PRP was successful or the gel injections were successful, you just smashed them all over again because it's a pressure problem. And the doctors will tell you, if you go to the regenerative medicine doctors, they'll tell you themselves, oh, you got to come back in 3 months. You got to come back in 6 months. This is an ongoing treatment that we're doing indefinitely. People come for years. They just keep getting injections over and over again. It's just not a cortisone injection, so it doesn't have the same side effects. Last piece of advice I'm gonna leave you with is get expert help. If you want to avoid a surgery, see somebody who specializes in avoiding surgeries. Now, I see people here in El Paso, Texas. You're welcome to come out and visit me if you want. There might be a specialist in your area. Just to tell you a little bit about my credentials, I'm a manual physical therapist. I've been through some training that less than 1% of PTs, physical therapists in the world have been through. And I have kind of a unique perspective on how to treat non-operative conditions like a meniscus tear, somebody who doesn't want to have meniscus surgery. Most physical therapists out there are helping people after surgery. And so if you go to those people, they're probably going to give you exercises that look very similar to what somebody who just had surgery is doing. It's not going to be fixing the root problem. You're going to be doing quad exercises very likely. Get the right kind of help. Now, if you can't find somebody in your area, we do offer a program called the Knee Meniscus Recovery Program. We've had thousands of people go through it and get an excellent benefit. It's completely online, on demand. You just need an internet connection and a device that can show you videos, a phone, a tablet, or a computer. And once you get access to this program, there's a link in the description below if you want to learn more. It's me walking you through the entire treatment approach that I use to help take pressure off the knee joint, fix the root problem, and get people back from, get them from being in pain, unable to put pressure through their knee joint because their meniscus is so swollen and irritated, all the way to getting active again, walking properly, cycling, even exercising with weights in the gym. So go check that program out if you're interested. If you just want more videos here on YouTube, I've got a playlist called the Knee Meniscus Help Playlist. I'll link you in the description for you as well. Hey, the video that I would recommend you check out first is this one right here. It's called The True Cause of a Meniscus Tear. It's what nobody's talking about. It goes in depth into the muscle imbalance and gives you a super clear explanation for those of you guys that are really analytical and want the details about this. Promise I'm not making this stuff up. It's legitimate. There's a logic behind it. Go check it out.